Patrick Rathbun.
Jim Mullins.
Daniel Mullins.
Caitlin Michael.
Matthew Mullins.
Danny Mullins.
My name is Jessica Rathbun. We have all heard stories of people who had to wait to receive care in the ER, or perhaps experience the wait ourselves. Maybe you have seen it in a movie or a television show. Maybe you or a loved one have been in the hospital and seen nurses zooming from room to room. This scenario is likely to get worse due to the national nursing shortage. The American Nurses Association, or ANA, states the nursing shortage isn't stopping soon. The average age of the American nurse is 50 years old, and the percentage of nurses working over the age of 50 is 53%. That means that over half of our nation's nurses are close to retirement age. The U.S. Bureau of Labor Statistics has projected a 19% growth in employment of RNs from 2012 to 2022, compared to an 11% growth for all other occupations nationally. When you add the 3 million patients who are getting ready to enter the Medicare age and the 8 million people who signed up for the Affordable Care Act, according to ANA analyst Peter McNamara, the U.S. demand for nurses is desperately growing. So I'm sure you're saying in your mind, why don't we just educate large groups of people to become nurses? That seems to be a simple, logical solution. Peter McNamara confessed that the pipeline itself is in danger. Title VIII funding for nursing education has been eaten away by inflation over the past few years. Plus, it only makes sense that the nursing faculty itself is aging. It is also hard to sell a teaching position to a nurse practitioner or a midwife who works at a hospital who would have to suffer a $20,000 to $30,000 a year loss to take a pay cut to teach at a university. The American Association of Colleges of Nursing emphasized that nursing schools turn away roughly 70,000 qualified applicants to nursing schools due to nursing faculty shortages. You may be wondering, does all of this still apply to me? Should myself or my family be worried? Do you feel safe when you go to the hospital? Shortages affect patient safety, and since I'm not speaking to a room full of nurses, you guys may be the patient. In a study by the American Hospital Association, or AHA, 60% of nurses felt that it is more difficult to provide quality care in today's nursing environment because of workforce shortages. Remember earlier when I was talking about waiting for the ER? The same study shows that roughly 40% of ER overcrowding is due to the nursing shortage. There is also a 25% rate of diversion of emergency patients who are sent across cities to wait for further care. These patients are in ERs and ambulances waiting for critical care. It may be your brother, your sister, your parent or child impacted by these shortages. Remember when I said you saw nurses zooming from room to room? A report by the U.S. Department of Health and Human Services shows that 30% of Medicare hospitalized patients were harmed from services or care that they received during their hospitalization. That same study shows that almost one-half of these harmful events were clearly and likely preventable. Higher patient loads were associated with higher mortality rates, higher admission rates, and higher infection rates. Nurses feel that they do not have enough time to spend with their patients, thus hurting patient outcomes. Because nurses feel they do not have time to spend with their patients properly regarding their patient education, their diseases, their medications, the need for lifestyle changes, and follow-up care. Another study discloses almost 95% of hospital RNs feel they have major problems with enough time to maintain the safety of their patients, detect major complications early, and work on increasing care collaboration with other team members. So now we have come to how do you fix a nursing shortage when you have an aging nursing faculty and those people who are qualified would take a substantial pay cut if they left the hospital to teach. The American Association of Colleges of Nurses started a national program to fill in vacant seats at nursing schools to meet the needs for RNs, nurse practitioners, and nurse faculty by creating a list of opening applicants that they can apply for. Johnson & Johnson has launched the Campaign for Nursing's Future to help educate the public about careers in nursing. It also has a scholarship fund for those interested in nursing. The Health Resources and Services Administration, or HRSA, has a scholarship for students interested in nursing in return for a monthly stipend in exchange for their service in a critical nursing shortage area. The ANA also states that some thoughts for employees to consider when trying to entice prospective employees is to remember that some employees want more personal time versus wage compensation. Employees want to balance personal life and work life. Younger employees are wanting on-site child care, and older, new graduates are wanting elder care to help care for the families that they were taking care of at home. Some facilities are also offering on-site banking and educational opportunities and places to buy workwear on site to help meet time demands. We are sure to reap the benefits of increasing the number of working nurses. We as a society want to feel healthy and safe and well taken care of. We want to know that we are being properly educated upon leaving the hospital or even at the doctor's office. We all desire to have strong, healthy, happy families, and more nurses would help.
6 minutes.